SNPhA's mission is to serve underserved populations.
And our chapter is very active in providing free health services such as blood glucose and blood pressure screenings to different immigrant populations such as Chinese, Korean, and more.
And oftentimes we would meet patients where English is not their first language.
Have you ever encountered communication barriers with patients at health fairs?
Communicating with patients who speak another language or have a physical disability may be difficult, but it's our responsibility as healthcare providers and students to overcome this barrier by educating ourselves on these issues.
And our prescription for service projects works to remove the language barriers between healthcare providers and patients. Our targeted populations are immigrants whose mother language is not English and the deaf community.
Our plan consists of 3 types of services. Number 1.
Hi, I'm Chloe Johnson and I'm a member of the American Sign Language Club at Stillcop. Studies have shown that even the best lip readers can only understand about 30% of English when lip reading. Patients that are deaf face both language and cultural barriers. Thus, the deaf community has a higher risk for poor health literacy and decreased access to health care, which ultimately leads to improper adherence and poor outcomes.
Host health fairs for the deaf community to increase their access to health care. We will set up quarterly health screenings with the Deaf Incorporation in St. Louis to provide blood glucose and blood pressure screenings and medication reviews. We will also invite SNPhA pharmacists to precept us and answer any additional questions patients may have. We will also have an ASL interpreter to help with communication.
I'm Stephen Kramer, and I'm a pharmacy student at St. Louis College of Pharmacy. I'm also going to Southwestern Illinois College, where I'm learning sign language to better communicate with the deaf and hard of hearing. This past summer, I made a connection with Deaf Inc., a deaf support and awareness group in St. Louis. I am now collaborating with them and SNPhA to hold a healthcare fair for the deaf.
Number 2.
We will provide training seminars for healthcare providers and students at the St. Louis College of Pharmacy. The seminars will have speakers with different cultural backgrounds, topics including medical interpreting skills, how to work with interpreters, and basic sign language and more.
My name is Raymond Okeke. I'm a second-year med student at St. Louis University School of Medicine, and I'm one of the student coordinators for the student volunteers for the HPES clinic. I think this is an awesome idea. I think it's very important to have healthcare providers work with patients, especially patients and people in the population who do not speak English as a first language or who might need some form of help, especially with interpretation.
Number 3.
There has been very limited patient education resources in multiple languages available online. On the American Heart Association website, for example, it takes many steps to get to the patient education page in Chinese, and the page only has words without any pictures, so it's very hard for patients to understand.
Create education handouts in multiple languages. We will collaborate with the Language Access Multicultural People, also known as LAMP, to translate patient education materials. We will first start with diabetes and stroke prevention and management materials in Chinese. We will also make these handouts available to all chapters on SNPhA's website, and we will track the number of downloads to see if other chapters are using them.
We are volunteers working as a translator here at Health Center.
We help people who need to communicate with doctors.
We feel it's very beneficial and useful if people here, especially Chinese customers who have a handout, so that when they go home, they can interpret their lab information themselves. So please
Support this project!
$1,000 would be used to hire American Sign Language interpreters. The rate is $50 per hour, and we estimate about 20 hours of interpreting services at health fairs. $1,000 for seminar speakers, $500 for LAMP translators for the health education materials, and health screening supplies such as blood pressure cuffs, blood glucose monitors, and test strips will be donated by St. Louis Student Pharmacists Association.
Hi, my name is Grace Gomes and I'm Vice President of the St. Louis Student Pharmacists Association, and we're proud to support this project and provide any healthcare supplies that you may need.
We hope our project will reflect SNPhA's national theme of the year.
We stand together. We encourage collaborations among different healthcare professionals. One mission:
To serve the underserved populations such as the immigrant population and the deaf community.
no barriers. We work to remove the language barriers.